Hello friends, this is Mohit Agrawal. I welcome you in our YouTube channel Soma's Evaluation Classes. So today we'll discuss about the Alzheimer's disease. So let's start with the topic. In this session, we will cover the introduction of Alzheimer's disease, definition of Alzheimer's disease, sign and symptoms of Alzheimer's disease, types of Alzheimer, risk factor of Alzheimer's disease, etiological and causes of Alzheimer's disease, pathophysiology of Alzheimer's disease, pharmacological intervention, biomarkers for Alzheimer's disease, and the therapeutic targets for Alzheimer's disease, and the prevention of Alzheimer's disease. So in this slide, Alzheimer's disease is a degenerative disorder of the brain that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest task. Alzheimer's is currently ranked as the 7th leading cause of death in the United States and is the most common cause of dementia among older adults. So people with Alzheimer's having trouble doing everyday things like driving a car, cooking a meal or paying bills. So they may ask the same questions over and over, get lost easily, lose things or put them in odd places, and find even simple things confusing. As the disease progresses, some people become worried, angry or violent. So in this slide, Alzheimer's disease is one of the top 10 leading cause of death in the United States. The 6th leading cause of death among US adults. The 5th leading cause of death among adults aged 65 or older. In 2020, as many as 5.8 million Americans were living with Alzheimer's disease. Younger people may get Alzheimer's disease, but it is less common. So the number of people living with the disease doubles every 5 years beyond age 65. So we can project it to nearly triple to 14 million people by 2060. Currently, there is no cure for Alzheimer's disease, though there has been significant progress in recent years in developing and testing new treatments, and several medicines have been approved by the United States, that is Food and Drug Administration, that is FDA, to treat people with the Alzheimer's disease. So in this slide, if I talk about the sign and symptoms of the Alzheimer's disease, so it is not a normal part of aging. Memory problems are typically one of the first warning sign of Alzheimer's disease and related dementias. In addition to memory problems, someone with symptoms of Alzheimer's disease may experience one or more of the following, that is memory loss that disrupts daily life, such as getting lost in a familiar place or repeating questions, trouble handling money and paying bills, difficulty completing familiar tasks at home, at work or at leisure, decreased or poor judgment, misplacing things and being unable to retrace steps to find them, changes in mood, personality or behavior. So basically you can see the list of signs and symptoms of Alzheimer's, that memory, and the second parameter is thinking and reasoning, making judgment and decisions, planning and performing familiar tasks, changes in personality and behavior, and the last one is preserved skills. So now I'm going to discuss about first symptoms of Alzheimer's disease, that is memory. So everyone has memory lapses at times, but the memory loss associated with the Alzheimer's disease persists and get worse. Over time, memory loss affects the ability to function at work or at home. People with Alzheimer's disease may repeat statement and question over and over, forget conversations, appointments or events, misplace items, often putting them in places that don't make sense, get lost in places they used to know well, eventually forget the name of family members and everyday objects, and the last is having trouble finding the right word for objects. So in this, second symptoms is, that is thinking and reasoning. So in the aspects of the thinking and reasoning, Alzheimer's disease causes difficulty concentrating and thinking, especially about the abstract concepts such as numbers. Doing more than one task at once is especially difficult. It may be challenging to manage finances, balance checkbook and pay the bills on time. Eventually, a person with Alzheimer's disease may be unable to recognize and deal with the numbers. So now I am going to discuss about the third symptoms of Alzheimer's disease, which might be a particular, that is making judgment and decision. Alzheimer's disease causes a decline in the ability to make sensible decision and judgments in everyday situation. For example, a person may make poor choices in social settings or wear clothes for the wrong type of weather. It may become harder for someone to respond to everyday problems. For example, the person may not know how to handle food burning on the stove or decision when driving. So in the aspects of the planning and performing familiar tasks, that is routine activities that require completing steps in order, become a struggle. So this may include planning and cooking a meal or playing a favorite game. So eventually people with advanced Alzheimer's disease forget how to do basic tasks such as dressing and bathing. So now we will talk about the next symptoms of Alzheimer's disease, that is changes in personality and behavior of Alzheimer's disease. That is, brain changes that occur in Alzheimer's disease can affect mood and behavior. Problem may include the following, like depression, loss of interest in activities, social withdrawal, mood swings, distrust in the other, anger or aggression, and the changes in sleeping habit. So now in the aspects of the preserved skill, that is despite major changes to memory and skills, people with the Alzheimer's disease are able to hold on to some skills even as symptoms get worse. Preserved skill may include reading or listening to books, telling stories, sharing memories, singing, listening to music, dancing, drawing or doing craft. Okay, so these skills may be preserved longer because they are controlled by parts of the brain affected later in the course of the disease. So now in this slide there are two types of Alzheimer. First is early onset and second is late onset. So both onset types have a genetic components. So if I am talking about early onset Alzheimer's disease, so early onset Alzheimer's disease occurs between a person 30 to 50-60 represent % of all people with the Alzheimer. Some cases are caused by an inherited changes in one of three genes. For other cases, research show that the other genetic components are involved. So most people with Alzheimer's disease have late onset Alzheimer's disease in which symptoms become apparent in their mild 60 of age. Researchers have not found a specific gene that directly cause the late onset form of the disease. So however, one genetic risk factor having one form of that is apolipoprotein APOE gene, which is called on chromosome 19, does increase a person risk. Okay, so in this slide if I talk about the etiology or causes of Alzheimer's disease, so the exact cause of Alzheimer's disease are not fully understood, but at a basic level brain protein fail to function as usual. This disrupts the work of brain cell, also called neurons, and triggers a series of events. The neurons become damaged and lose connection to each other. They eventually die. Scientists believe that for most of the people, Alzheimer's disease is caused by a combination of genetic, lifestyle and environmental factor that affect the brain over time. In less than 1% of cases, Alzheimer is caused by specific genetic changes that almost guarantee a person will develop the disease. So in these cases, the disease usually begins in the middle age. Researchers trying to understand the cause of Alzheimer's disease are focused on the role of two proteins. The first is beta amyloid is a fragment of a larger protein. When these fragment clumps together, they appear to have a toxic effect on the neurons and to disrupt communication between the brain cell. These clumps form larger deposits called amyloid plaques, which also include other cellular debris. And the second one is tau protein. So tau protein play a part in a brain cell support and transport system to carry nutrients and other essential materials. So in the Alzheimer's disease, tau protein changes the shape and organize into structures that is called neurofibrillary tangles. So these tangles disrupt the transport system and the cause damage to cells. So you can see in the mentioned picture is that healthy brain and the brain with Alzheimer's disease. So you can see in the brain of someone with Alzheimer's disease, amyloid plaque form and tau protein changes the shape and become tangles. Okay. So in these slides, now I'm going to discuss about the several risk factors are associated with the Alzheimer's disease. So the first one is increased age. Increasing age is one of the greatest known risk factor for Alzheimer's disease. So Alzheimer is not a part of typical aging, but as you grow older, the chances of developing it increases. So one study found that every year there were 4 new diagnoses per 1000 people ages 65 to 74. Among people ages 75 to 84, so there were 32 new diagnoses per 1000 people. For those 85 and older, there were 76 new diagnoses per 1000 people. So in the second risk factor, that is Down syndrome. Many people with Down syndrome develop Alzheimer's disease. This is likely related to having 3 copies of chromosomes. Okay. Which chromosomes? The 21 chromosome is the gene involved in the production of the protein that lead to the creation of beta amyloid. If I am talking about the beta amyloid fragments can become plaque in the brain. Symptoms tend to appear 10 to 20 years earlier in people with a Down syndrome than they do for the general population. Okay. The next factor is head trauma. Several large studies found that people ages with the 50 years or the older who had a traumatic brain injury, so had an increased risk of dementia and Alzheimer's disease. So the risk is even higher in people with more severe and multiple traumatic brain injury. Some study found that the risk may be greatest within the first 6 months to 2 years after the injury. Now the fourth one risk factor is poor sleep pattern. Same research has shown that poor sleep patterns such as trouble falling asleep or staying asleep are linked to an increase the risk of Alzheimer's disease. Another one risk factor that is excessive alcohol consumption. So drinking larger amounts of alcohol has long been known to cause brain changes. Several large studies and reviews found that alcohol use disorders were linked to an increased risk of dementia, early onset dementia in particular. So now the next is mild cognitive impairment. Mild cognitive impairment is a prominent risk factor is that someone with mild cognitive impairment has a decline in memory or other thinking skills that is greater than usual for the person's age. But the decline doesn't prevent the person from functioning in social or work environment. However, people with the mild cognitive impairment have a significant risk of developing dementia. When mild cognitive impairment affect mainly memory, the condition is more likely to progress to dementia due to the Alzheimer's disease. A diagnosis of mild cognitive impairment offers people the chance to put a greater focus on healthy lifestyle changes and to come with a strategy to make up for memory loss. They also can schedule regular healthcare appointments to monitor symptoms. And the last risk factor, that is air pollution. So some studies in animal have found that air pollution particulates can speed the breakdown of the nervous system, and human studies have found that air pollution exposure, especially from traffic exhaust and burning wood, is linked to a greater risk of the dementia. Now, the important part is that some prominent and foremost research has been shown that the same risk factor are associated with the heart diseases also may increase the risk of the dementia or the Alzheimer's disease. It is unclear if these factors increase risk of dementia by worsening Alzheimer's changes in the brain or by leading to brain vascular changes. So, they may include lack of exercise, obesity, smoking, high blood pressure, high cholesterol, poorly controlled type 2 diabetes. So these were the symptoms of the related to the cardiovascular disease with the Alzheimer's disease. So in this slide, we will talk about the pathophysiology of the Alzheimer. So the two pathophysiological hallmark of the Alzheimer's disease are extracellular beta amyloid deposits in the neuritic plaques, and the second is intracellular neurofibrillary tangles, which is almost in the paired helical filaments. So the mechanism by which beta amyloid peptide and neurofibrillary tangles cause such damage is incompletely understood. So there are several theories. The amyloid hypothesis posits that progressive accumulation of beta amyloid in the brain triggers a complex cascade of events ending in neuronal cell death. So loss of neuronal synapses and progressive neurotransmitter deficits. So all of these effects contribute to the clinical symptoms of the dementia or the Alzheimer's disease. So in the next, you can see in the mentioned image that the accretion of tau protein correlates very closely to the cognitive decline and brain atrophy, so including hippocampal atrophy. So in this neuropathology of the Alzheimer's disease, there is a loss of neurons and atrophy in the temporofrontal cortex, which causes the inflammation and deposit the amyloid plaques and abnormal cluster of the protein fragments and tangle bundle of the fiber. Due to this, there is an increase in the presence of monocytes and macrophages in cerebral cortex. So it is also activates the microglial cells in the parenchyma. So this was the summary of the pathophysiology of the Alzheimer's disease. So in this slide, now it is very important is that I am going to talk about the pharmacological intervention or the treatment of Alzheimer's disease. So some medications to treat Alzheimer's disease. The first is cholinesterase inhibitor. So cholinesterase inhibitor modestly improve cognitive functions and memory in some patient. So generally donepezil, rivastigmine and galantamine are equally effective, but tacrine is rarely used because of its hepatotoxicity. So now the another treatment with the donepezil is a first line medication because it has a once a day dosing and is well tolerated. So the recommended dose is 5 mg orally once a day for 4 to 6 weeks. Then it increased to 10 mg once a day. So we can say that donepezil 23 mg once a day may be more effective than the traditional 10 mg once a day dose for moderate to severe Alzheimer's disease. So treatment should be continued if functional improvement is apparent after several months, but otherwise it should be stopped. So the most common adverse effects are gastrointestinal, that is nausea, diarrhea. If I am talking about the memantine, so it is a N-methyl D-aspartate receptor, that is called NMDA receptor. So it is an antagonist appear to improve cognition and functional capacity of patient with moderate to severe Alzheimer's disease. So the dose is 5 mg orally once a day, which is increased to 10 mg orally twice a day over about 4 weeks. For patient with renal insufficiency, the dose should be reduced or the medication should be avoided. Memantine can be used with a cholinesterase inhibitor. If I am talking about the biomarkers, so biomarkers can also be a great value in a Alzheimer's disease or the drug development to select the most optimal drug candidates for large and expensive phase 3 clinical trials. So biomarkers will also be important to provide evidence that a drug affect the underlying pathophysiology of the disease, which together with a beneficial effect on the clinical course, and it will be essential for labeling the drug as having a disease modifying effect. Now you can see the several biomarkers to treat Alzheimer in the mentioned picture. MTDL. What is MTDL? So it is multi-targeted directed ligand, that is called MTDL. So MTDL moves towards with the promising method in the multifactorial etiology of the disease to search for a new drug of the Alzheimer's disease. If I'm talking about the galantamine, so in current year isolation of the galantamine is done by numerous members of the has turned out to be an essential therapeutic option used to delay the process of the degeneration of the neurons in the Alzheimer's disease. So if I'm talking about the galantamine is well tolerated during long-term treatment of the Alzheimer's disease. So cannabinoids system has become a potential therapeutic approach to treat the Alzheimer's disease or the dementia. So the cannabinoid is composed of a number of cannabinoid receptor, that is CB receptor, including well characterized CB1 receptor and CB2 receptor. If I'm talking about the antibodies, so antibodies, intravenous immunoglobulin or purified amyloid beta antibodies may be suggested as a possible treatment as it modify amyloid beta and amyloid beta 1 level, suggesting that the potential utility as a therapy for the Alzheimer's disease. If I'm talking about the metals, so lithium has also been regarded as a neuroprotective agent and a candidate drug for a disease with a modification in the certain neurodegenerative disorder, namely Alzheimer's disease. So if I'm talk about the stem cells of biomarker to treat the Alzheimer's disease, so recent preclinical evidence suggests that stem cell can be used in the treatment of Alzheimer's disease because the process of stem cell based therapies of Alzheimer's disease include stem cell mediated neuroprotection and tropic action. So anti-amyloidogenesis, beneficial modulation and replacement of the neurons. So now we will talk about the some therapeutic target for the Alzheimer's disease. So different hallmarks of the disease have been reported, such as deposits of the beta amyloid around neurons, hyperphosphorylated tau protein, oxidative stress, okay, dyshomeostasis of biometals, low level of acetylcholine, etc. So various therapeutic targets for Alzheimer's disease are summarized in the mentioned picture, which you can see in this slide. So basically there is no cure for the Alzheimer's disease and the drug therapy for the disease is still in its infancy. Medication which are approved for the treatment of probably Alzheimer's disease can help have power over the symptoms of the Alzheimer's disease, but do not show or slow down the progression or reverse the course of the disease itself. So the comprehensive management of Alzheimer's disease entails both non-pharmacological and pharmacological interventions. So there is pharmacological and non-pharmacological intervention. So if I'm talking about the non-pharmacological and pharmacological intervention or the therapies can improve also the quality of life of people with the suffering from the Alzheimer's disease. So NPT might be a good sleep, physical activities and music therapy, that is talking about the non-pharmacological intervention. So there is evidence from a modest number of well-conducted randomized controlled trials that various non-pharmacological approaches, including cognitive training, cognitive rehabilitation, cognitive stimulation therapy, confer modest but significant benefits in the treatment of the cognitive symptoms that is likely to a Alzheimer's disease, and that there may be addictive benefits in the combination with cholinesterase inhibitor therapy. So now this is the last slide. So here I am going to discuss about the how to prevent Alzheimer's disease. So there is various kind of parameters you can see in this slide, that is preliminary observational evidence suggests that risk of Alzheimer's disease may be decreased by the following. First is continuing to do challenging mental activities. What? Learning new skills, doing crossword puzzles, and well into in a old age. Exercising regularly, controlling hypertension, which is very mandatory, lowering cholesterol level, which is also prominent factor, consuming a diet rich in omega-3 fatty acids and low in saturated fats, drinking alcohol in modest amount, whatever. So thank you so much for watching this informative session. If you enjoyed this video, please do like, share and subscribe our channel, that is Soma's Evolution Classes.